So, coming into a comfortable seated position, and if you're near the wall, if you've got your board, you can sit back into the wall because that does give you that lovely sense of openness and space into your lower back. If you are more than 34 weeks pregnant, now is the time to not be sitting with your legs crossed. There's a lot of pressure in the circulatory system now, so you might want to just bring the soles of your feet loosely together with the legs in a diamond position. If you've got any hip niggles, anyway, besides if you're not 34 weeks, you might feel more comfortable with the legs being stretched out in front. So you find what works for you, what position you're most comfortable in. And then we're just going to start as we always do with our centering and our connecting. So bringing one hand into the center of your chest. So this is emotionally and energetically our heart space. It's where all our love, emotions and our connection comes from. But it's also the place where we breathe. So it helps us to connect to our breath as well. And then you're going to place your other hand down onto your baby. And then once you've done that, you can just close your eyes. And just take a moment. Notice how you feel. And just take a quick journey through your body. So as always, just checking in to see if anything feels different. During pregnancy, our body is changing very rapidly. And so from week to week, you may notice some subtle or maybe even some not so subtle changes that are happening. And then once you've made that connection with the whole of your physical body, be aware of the hands that, the one that's over your baby, and just notice if you can feel any movements from your baby at the moment. So they may be sleeping, they may be resting. So usually around every 20 minutes, give or take, is the amount of activity that your baby is likely to do. So noticing if they're having an active moment or whether they're having a resting moment. And if you're less than 20 weeks pregnant or just around the 20-week mark, you might not actually have had any big movements yet, or even any little movements. You might feel the odd little fluttering, the odd sensation, but you may not have had any identifiable movements from your baby. Notice also if there's a little bit of movement that comes from your breath. So as you breathe in, notice if there's a slight expansion of your belly, and as you breathe out, notice if there's a slight retraction from your belly. And then move your attention to the hand that's sitting over the chest. And noticing again the breath. As you breathe in, hopefully feeling a little bit of an expansion, feeling the ribcage lifting and expanding. And as you breathe out, just feeling the ribcage retracting back down. And with your awareness now on the breath, see if you can create a little bit of a resistance by contracting the muscles around your throat slightly for the ujjayi or ocean breath. And if you don't feel comfortable contracting your throat, you might want to instead use the nostrils as a contraction. Now, sometimes in pregnancy we get very congested nasally. So you might not need to actually create any resistance to your breathing if the nostrils are already congested. But then following that slight resistance, see if you can slow the breath down and possibly breathe a little bit more deeply. So our normal natural breath can be quite shallow, but we are breathing for 2. Your baby needs a supply of oxygen in the same way that you do. So if we breathe more deeply, if we breathe more fully, if we breathe more consciously, we can then invite more breath, not just in for ourselves, but also for our baby. So just take 2 more breaths. And at the end of the next exhalation, you can just relax your hand down. Okay, so we're going to start our session using some stretches for the upper back and for the lower back. So we're going to start lying on our right side, and it might be more comfortable for you to place your head either on a block or on a cushion. So coming over onto your right side and placing your cushion or your block underneath your head, and then bending the knees up as if you were sitting on a chair. So the knees are at a right angle to the thighs, the shins are at a right angle to the knees. And then just taking both arms out at chest height, just reaching them in front of you. The block or the cushion should be a little way towards the back of your head, because your head will turn backwards as you create these twisting movements. So this first twist is going to get into the thoracic spine, so it's particularly good if you've got any shoulder niggles. So as you next breathe in, you're just going to slide your left hand up the right arm. You're going to slide the hand over the right collarbone, over the left collarbone, and then just drop your elbow towards the floor. It may not reach, and that's fine. You just take it as far as it will go. And then as you breathe out, you're going to slide that hand slowly all the way back. So we're just sliding all the way up to the left collarbone on the inhalation. Let the elbow drop towards the floor. Don't let the knees separate too much. They can separate a little bit, but not too much. And then on the out breath, sliding it all the way down. So we're going to do that a few more times, getting a nice rhythm going with your breath. And with every movement, with every repetition, you might find that the body opens up a little bit more. So you can feel a little bit more spaciousness around the chest, and particularly around the upper back. Now if your elbow reaches the floor, if you can comfortably get the elbow onto the floor, what you can do now is just open the arm out. So the left arm is straight, just as the right arm is straight, and just hold it there for a couple of breaths. So that's another option. If it doesn't touch the floor, or even if it does touch the floor, you might prefer to carry on with the dynamic form of the practice, which means carrying on with the breath, moving to open on the in-breath and then coming back on the out-breath. So again, your choice, however you want to continue. And we're just going to take 2 more breaths here. So whether you're holding the pose statically with your left arm extended, or whether you're continuing to work with the dynamic form of the practice, we're just going to take 2 breaths. When you finish your second breath, you can bend the elbow and slide the hand all the way back. Okay, so now we're going to go deeper into the upper back and the shoulders. So you're going to take your left arm and bring it parallel to the ground. We're going to do our helicopter arm. So you're going to take the arm up towards your head and then circle it back behind you. You will have to kind of rotate and twist backwards to enable that to happen. And then you circle the arm down towards your hip and then all the way back to the start position. So that's your movement. You're going to try and keep the arm completely horizontally as a helicopter rotor blade would do. But I fully appreciate that where there's tightness in your shoulder, in your upper back, there may be a little bit of jiggling around. The arm might lift higher up, it might lift lower. You're going to make one more circle. And then you can just relax. We're going to roll onto our back, so you might want to just put your pillow or your block to one side, come over onto your back. And another way to stretch out the upper body is to actually take your arms back behind you onto the floor, but take them into a Y shape. So don't try and get the arms really close to your ears. Instead, open the arms out to a very soft Y shape, where the elbows are bent and the wrists are wider than the arms. And in this position, you'll get a little bit of a stretch across the front of the body. So it's another opportunity to get into the upper back. And then bring the feet together, or as close together as you feel comfortable with. As you next breathe out, slowly take the knees over towards your right side. So now we're working on the lower back. And as you breathe in, let the knees come up to the center. As you breathe out, take the knees over to the left side. And as you breathe in, let the knees come up to the center. So just going to keep that going for a few more repetitions. So again, the more repetitions that you do with any of the moves, the more the muscles relax into it and they start to lengthen and they start to stretch. And once that happens, any tightness around the joint will start to ease off. So it's by doing these repetitive movements that we can allow our muscles to begin that process of softening. Now the next time you take your knees over to the left, we'll roll all the way over onto the left and we'll do our shoulder stretches on the left side. So now you'll need your block again, if you can find what you've done with it, I can't find one. And you're going to come onto your left side, have the block or the cushion pushed some way towards the back of your head. And then the back is straight, the knees are bent up at a right angle to your body, shins at a right angle to the knees, and then your arms are going to stretch out at shoulder height along the floor. The next time you breathe in, you're going to slide your right arm all the way up the left arm, across the left collarbone to the right collarbone. Just let the fingers rest on the right collarbone as your elbow drops towards the floor. Let your head turn with the movement, so don't try and restrict the movement in your head. And then as you breathe out, you slide your hand all the way back down to the left hand. And we're just going to carry on in this same way. So, sliding the hand all the way to the right collarbone and then just allowing the right elbow to drop towards the floor. It may or may not touch. And then every time you breathe out, you slide your hand all the way back. Just keeping that rhythm going with your breath. next time you take the arm over, if your elbow touches the floor comfortably, you can unfold the arm, and then you might want to stay there and just hold the position, or you might want to carry on working dynamically with your breath. So again, you decide what feels best. And we're going to stay for 2 breaths. So we're going to continue for 2 breaths. If you're doing repetitions, you'll do 2 more repetitions. If you're holding the pose statically, you'll stay there for 2 breaths. Notice how that's starting to feel in the upper body, in the shoulders, in the upper back, in the neck, and even on the rib cage. And then the next time you breathe out, you can bend the elbow, slide the hand all the way back. And then we're going to work with our helicopter. So now you're going to take your right arm and just bring it up parallel to the floor. Circle the arm up towards your head. Circle it back behind you. Let the trunk and the head turn. Circle the arm down towards your hip. And then back up on top of your left arm. So just creating one continuous circle, aiming to get the arm completely horizontally, but also understanding that there are possibly going to be a little bit of niggly bits, a little bit of tight spots where the arm isn't going to be able to do that. And then the next time you complete the circle, you can relax the hand. And then from here, you're going to push up onto your hands and onto your knees. So just ease yourself up slowly, take your time, and then come over onto your hands and your knees. So another really good stretch for the lower back is one that I tend to do in these classes. I call it one of my bread and butter poses because it's just such a good position. So all fours, hips on top of your knees, shoulders on top of your hands. You will also need to make enough space between your knees for your baby to fit. So you might need to take the knees a little wide, and obviously the further on in your pregnancy you are, the wider the knees will need to go. Also, if your baby is lying transversely, which we'll have a look at later on, because I've got my pelvis with me today, so we'll have a look at what a transverse baby looks like. But basically it means they're sideways, which means there's more width to your belly. So you might need to take the knees wider if your baby is transverse. So as you next breathe out, tuck your tailbone under, push your spine up to the ceiling, and then slowly take your hips back towards your heels. Now at this point you can find out whether your knees are wide enough or not. If they're not, you can take your time, maybe spread the knees a little bit wider so that you can comfortably drop your baby down in between your knees. And a little sway from side to side can be quite nice here as well, once you're back in this position. So again, this is what gets into your quadratus lumborum, so those muscles in that lower section of your pelvis, lower section of the lower back. And then breathing in and come all the way up. And then same thing again, breathe out, roll the spine to the ceiling, get a nice rounding in the back, and then take the hips back onto the heels. And breathing in, coming all the way up. And then just do that one more time. So getting that rounding in the back. And it's that rounding as you go back where you can get that pull in the lower back, which pulls these muscles in your lower back, which quite often get compressed, particularly during pregnancy. and then rise all the way up. Okay, and then from here you can come and bring the soles of your feet together. So heartburn?
Yeah.
Heartburn? Oh.
Right. Dinner was going to come back.
Yeah, right. Yeah, right, okay. Yeah, it's not a great position for heartburn, is it? Okay. Alright, let's just do a little bit of heartburn stuff then. Take the arms up over the head, take hold of your opposite elbow. So every time you get that heartburn feeling, constantly, just sit like this for the next few months. So taking hold of the elbows and just elevating the rib cage up away from your belly. And as you breathe out, just gently ease over to one side. And as you breathe in, come back to the center. And as you breathe out, gently ease over to the other side. And inhale, come back to the center. Do the same again. And then you can release the hands and come all the way down. Okay, so last little movement for the quadratus lumborum. So we can come back into our butterfly position where the soles of our feet are together. And if you take the soles of your feet a little bit further forwards, you've got some room for the spine to manipulate, or articulate is the word I'm looking for. As you breathe out, gently bow down towards your feet, and you'll feel that pull again in the lower back. And then breathe in and rise up. And then you're going to bring your hands either side of your right thigh. And then you're going to breathe out and bow down towards your right knee. So now you'll feel that pull in the left quadratus lumborum. So you see that pull in the lower back, that's your QL muscle as you go down. And then you breathe in and you come up. We'll come back to the center. Breathe out and bow down. Breathe in and rise up. And then take the hands either side of the left thigh, turn towards your left knee, bow down. On the out breath, rise up on the in breath. Come back to center. And then just do the same thing again. So one to the middle, one to the left, one to the right. Have you just had your dinner?
Yeah, I think I just need to have maybe a little bit before I come and then when I get home.
Yeah, it's a tricky time, isn't it? Because obviously, you know.
I have it an hour before.
Yeah, so with yoga, what we normally say, because we do quite a bit of compression, we normally say 2 to 3 hours, but then you can't do that because it's still at work. So it is tricky, you know. I think most people struggle when they do any kind of yoga in the evenings to find the ideal time to eat.
Maybe a small meal and a small meal.
Small, yeah, just maybe 2 halves, like you say.
Yeah.
So I think like a bowl of soup is quite good because it will go through quite quickly.
Yeah.
Yeah, I've had soup tonight. Okay, could you feel that? Yeah, so I like that twisting forward bend is the one that really gets into the quadratus lumborum. Okay, so let's have a look at this optimum fetal positioning. So I've given you all a chair. Now these are not very comfortable chairs. But I'm going to show you how to sit back to front on a chair for optimum fetal positioning, and then you can, when you do this at home onto like a dining chair, for example, it's going to feel much more comfortable. So these chairs are too wide. So they're a plastic bucket seat, so they're already wider than the average seat. And then you've got these metal rims on the outside as well. So when you come to sit back to front on them, you have to sort of go a lot wider. I mean, even I'm struggling with that, and it's not very comfortable. And it kind of pinches in the thighs. But on a dining chair, it's actually quite comfortable. So if you want to just come and see what it feels like, and then if you're not happy, you can sit back down on the floor or sit the other way. onto your chair. So I want to get you into some static positions, and I'm going to talk about optimum fetal positioning, what it is and why it's important. So in this position, what you can see is your pelvis is tipped forwards. Can you feel the difference? So the spine's nice and tall, so actually for the back it feels quite nice as well. So provided you've got a comfortable chair in the lower part, then actually this can be quite comfortable to sit on, but you also need a low back, and again most dining chairs are high back, so then you've got the problem the other end in that you can't put your elbows on the chair. So there's probably no perfect solution unless you've got a low backed narrow chair. But I'm hoping you can feel this kind of really nice openness in the lower back. The belly is nicely folded forwards and the pelvis is rotated into its proper upright position. So are you all okay here, more or less? So you're welcome to stay in this position. But I'm also going to show you the next position. So why is it important to sit backwards on a chair and not in the normal position? And I'll show you why. Because when we sit on a normal chair, if we sit with our back, what happens for most of us, unless we've got very long legs, what happens to most of us is this. In order to get our feet on the floor, we have to slump back. So can you see that position now? I've really collapsed in my back. So where we had the pelvis forwards position, I've now got my pelvis tilting backwards. To sit upright in this chair with my pelvis in a slightly forward rotated position, my feet don't touch the floor. And I've got quite long legs. So what I recommend when you're sitting in any chair, unless you're tall and you can get your feet comfortably on the floor, is to have something underneath your feet. So if you sit on a chair at work, get something like a footrest underneath your feet so that your knees are level with your hips. So in optimum fetal positioning, we need to have the thighs vertical or sloping down. So what we need is the knees level with the hips or lower than the hips. If the knees are higher than the hips, this is a malposition in terms of optimum fetal positioning, and actually it doesn't feel nice. So that's your clue, isn't it? Sitting forwards like this, doesn't that feel nice? Apart from obviously it's not very nice on the legs, but in the belly and the chest, does it feel nice? Because you're in a natural position, everything's tilting forwards. And so in optimum fetal positioning, this is what we're looking for, because what you've done here is you've given your baby space. And this is the important thing. So you can either carry on sitting in this position. If it's not comfortable, then you can come off it, sit in a normal position, but put your feet, in fact, come round, try this. Come into your a normal seated position and just see if you end up having to slump backwards. So Sally, you're probably okay because you're quite tall, but I'm suspecting you're quite tall as well. Camilla, you feel, yeah, your knees and thigh angle looks okay. Does it feel kind of spacious? It's not as spacious as sitting forwards, is it? No. But Katie, you definitely can. You can feel the difference. Yeah. Doesn't that feel horrible? Yeah. Compression. So on you. Yeah, and then of course your baby hasn't got as much space. So Melissa, can you feel you've got into the slump as well? Bryony, you're just about right there. So what I would say for those of us, like me, including me, who are slumping, is you would need to have something under your feet so that you've got that lift, and then you can bring the pelvis in the upright position. So I'm going to leave you to sit in whichever of those positions you're comfortable with. Because if you've got your ball, you can sit on your ball, because again, that is one of the perfect positions for you. So in terms of optimum fetal positioning, it's actually sitting that's important. We spend how many? 8, 9, 10 hours a day sitting, and how you sit is the most important aspect in terms of how is that going to affect your baby being able to get into the correct position for labour. So let's have a look at this. So optimum fetal positioning is the medical technical term for it, and it's the term used to describe the position of the baby in the pelvis during the last few weeks of pregnancy. And it's this position that will dictate the ultimate outcome of your birth. You know, obviously with a few other things aside as well. But generally speaking, how your baby presents in the pelvis prior to labour and also during labour will be one of the biggest factors in the outcome. So in the last month or so of your pregnancy, so from 34 weeks onwards, your baby is going to start descending, all being well, into the pelvis. And if your baby is given enough space to do that, your baby will. We don't know why. It may be just a really inherent natural wisdom within us all to get into the right position for labour, or it may be that it's the most comfortable position, because actually the baby's head fits nicely into the pelvis and then they can tuck up, and actually when they go the other way it's a little bit more uncomfortable for them. So that is a much more comfortable position. There's a lot more space there for them. But it's just one of those unknown things. It might be just a collective consciousness thing, you know, where just the inner innate wisdom within us that tells us how to be birthed. So most of us understand that it's the head down position that we want. I mean, there are lots of reasons why head down position is the most favourable. The first one is because the head and the shoulders are the biggest part of the body. So once the head and the shoulders are out, the rest of the baby will just slide out because there's nothing bigger than the shoulders. If they go bum first, we don't know if the head and the shoulders are going to fit. So then you've got a bit of a tricky situation. You've got our baby half out if it's come out bum first. So breech position can be birthed. They are often birthed. But what's happening now is that because most breech babies are given a C-section, there's less and less midwives who are able to actually deliver a breech baby. In all honesty, there's very few midwives out there who have even seen a natural birth. It's quite frightening, really. You know, I know a lot of mums, because most people doing natural births are people that come to these kind of classes because you're invested in it. You know, you're interested, aren't you? That's why you're here. You're in the minority. And I've had so many women in my classes that have said to me afterwards that, I remember one saying that she had a midwife, this midwife at 30 years a midwife, sobbed at the end of this labour because she'd never seen a natural birth. And you think after 30 years of midwifery, that is utterly disgraceful, isn't it? That's what you're up against. So for a natural birth, this is where it starts. Optimum fetal position, you know, you want to get your baby in the right position. But it's not just a case of head down, actually, because you can have a malpresentation in a head down position as well. So when we look at the female pelvis, the female pelvis is widest in terms of the pelvic outlet from hip to hip, particularly during pregnancy, because all these areas are stretching. So this place at the front, the symphysis pubis, this is stretching. And then at the back here, you've got your sacroiliac joints here, which are normally really fixed, solid. I don't know if you can just see inside there, there's like a groove. Well, that's ligament. I don't know if you can quite see. So where this flat bone is here, the sacrum, normally it's fixed solid. And then during pregnancy, all the ligaments that hold this together start to stretch. And that's why you get, you know, when you get hip ache, sometimes you get hip ache really early on in your pregnancy, like 6, 7, 8 weeks, when it's clearly not baby pressure. Is that what you had?
Yeah, I think I did. Oh, you did.
You did, yeah. And
I'd get up after sitting down and be like, oh,
yeah.
and I couldn't like move. It was really weird.
And it's in because you often perceive that all the aches and pains you get in your hips are baby pressure. It's not. Because you've barely got a bump now, you know, because you're still quite early on. So it wasn't baby pressure at all, but it is these ligaments. And the sacrum is like the fulcrum of the whole body. Everything comes, the spine, the legs, all mobility comes from your sacrum. So when this starts to get loose and jiggles about, and I've purposefully loosened my pelvis so that you can kind of see what's happening. And then you can understand, can't you? Because these are all nerve endings coming out through here. And that's what causes the pain. And that's because this is softening to make more space. So towards the end of your pregnancy, you're going to have a wider pelvic brim. Women generally do anyway. This is why they can always tell when they find skeletons, whether it's male or female, because a male pelvis is round and a female pelvis is oval shaped. So we already have this inherently within us, and then that diameter gets wider during pregnancy. When you look at a baby's head, or even a human head, it's wider from front to back. Yeah, so this is the widest part of a baby's head. So it stands to reason that the easiest route out of a pelvis for a baby is to have the head sideways in. So the optimum fetal position is this one. Slightly round towards the front, so not fully side on, just very slightly turned, but it's the head sideways. Yeah, so that's how they want to present, ready for labour. It also means the baby can tuck his chin under. So he's in proper sort of, fetal position. It's got a name, hasn't it? So the chin tucks under. When the chin is tucked under, the crown of the head is presenting. So as it pushes onto the cervix and then through the birth canal, the baby can kind of create its own pressure on the way through. Now, look at that and relate it to this. Okay? So this is a common presentation for labour, back to back, and this is a nightmare. You do not want this to happen during labour for lots and lots of reasons. So this is what I would call, this is a malpresentation, but when you are being scanned, they're not looking at this, they're just looking head down, bum down. Because also the position can change during labour anyway, with all of that kind of contracting happening. But also, modern medical science doesn't really kind of look at these little intricacies because they can't affect it. Because they don't really use movement. The NHS, all modern medical science all over the world does not use movement. It uses surgery, pharmaceuticals. They don't use movement at all. So they don't, anything they can't fix, they don't measure. But this back-to-back position, there's various things on. The first thing is, it's incredibly painful for the mum because your spine now is being rubbed against your baby's spine, and it is really, really, really painful. It's probably painful for the baby as well, but we don't know because we can't ask them. But you can imagine, can't you, if it's painful for you, it's going to be painful for your baby as well. The second thing is the position doesn't fit so well. The baby, very often the baby can get stuck in this position. So in a lot of these cases where, you hear that your baby got stuck and they had to have forceps. If the forceps don't work, then you have a C-section. A lot of the time it's because the baby is, not in a good position this way, and the head just isn't going to fit through because it's, widest versus shortest. Also, then you've got the baby's head, chin is up, head is flexed. So again, the baby can't kind of push down. In this position, you've got a lot less power, haven't you, if you think about that, even from your own perspective. So this is what you don't want. So again, the only way to help with that is to give your baby lots of space. And every time you slump and you sit, like we looked at on the chair, and if you're slumping, your baby hasn't got enough room to move. So the best thing you can do to help your labour, as well as coming to lots of classes and learning techniques and breathing and positions, is every time you sit down, from 30 plus weeks, get it into the consciousness that you want to give your baby space. And the really good clue is that it just doesn't feel nice for you. And that can be your trigger. So every time you sit and you slump, you go, ooh, and you go, ah. And you can change your position. So So then we looked at, transverse is this. So when a baby is in a transverse position for labour, it's not happening. You know, this would be a very dangerous, you know, in pre-C-section times, very bad outcome. That baby's not coming out. And so that's why in our modern society we have to be very grateful that we do have C-sections. If you have a transverse baby, you take the C-section, you say thank you very much.
Because that at work, she's coming with a second, but her first was that way, and she had to have booked in for a C-section.
Yeah, you cannot birth a transverse baby, and they can't often turn, because at term they're big, and they just can't turn. They can't get into the right position. So you can imagine, you know, in previous times that would have been a very sad affair. But that's why we are very lucky, you know, that we do have these options. Yeah, so that's a transverse presentation. And as I was saying, you know, sometimes you get babies in transverse, you know, at 26 weeks, plenty of time to turn, but you can tell because you feel very broad, you feel really wide, and you get, you know, pains here and here, and then it feels very empty in your belly, because your baby's not in your belly, it's sitting on your ribs. So you want to do all you can to get your baby into one of these sideline positions. They do tend to favour the left lying position. So, you know, if we're being really picky, it's called left occipital, lateral. Posterior, yeah, so occiput lateral, which means head sideways. And they often say the left side is the optimum. And the only reason for that is because the liver is on the right side. And I think the baby there's a bit more space in your womb on the left side, because the liver will kind of take up a little bit of space on the right side, but it's minimal. So right occiput can be fine as well. So this is the position that we're looking for prior to labour. Yeah, so these OP labours, they're called OP, back-to-back OP labours. They're quite long as well, so as well as being incredibly painful, they can often be very long. It takes the baby so much longer to actually open the cervix, because there's no pressure on the cervix from the baby's head, and also getting through the birth canal in this position can be quite tricky. So these are the labours that go on and on. You know, when you hear stories of like, oh, I was in labour for 3 days, yeah, probably back to back. The good news is you can shift the baby's position during labour if you move. So again, this kind of makes you think, why do they lie everybody on their backs in labour? When you've got all these tools at your disposal to really, really help the outcome of the labour. It's just insane, isn't it? So, yes, it's quite difficult to actually determine during labour whether your baby's back to back. You know, the two signs are that it's a really painful labour and it's a really long labour. Now, if you've never had a baby before, how are you going to know if this is normal painful, normal long, or not? So it's just really not something you can tell. So what I normally suggest to people when I do birthing workshops is you do the moves anyway. So I'm going to show you these moves now, these moves to create space in your pelvis for your baby to find the optimum position. You do them anyway because they're nice moves for labour, but also you just want to give your baby the optimum opportunity to get into the best position they can so that your birth is quick and easy. And that's what you want, isn't it? Nice, much nicer for your baby, because God knows what being born must be like. It's bad enough for the mother, so can you imagine what your poor babies are going through? So the shorter and more comfortable we can make labours for you and your baby is, you know, is a better outcome, isn't it? Okay. Yeah, so normally around 34 weeks we say this is the time to start thinking about it, which is why I wanted to do this class today, because I know a few of you are going to start edging into 34 weeks over Christmas, so I didn't want to leave you for 3 weeks and not have any optimum fetal positioning. There are some occasions when it's either less or more. So if it's your second baby, your abdominal muscles stretch a little bit more easily, your pelvis stretches a little bit more easily, you've got more room. So, you know, second time, or, you know, third, fourth, fifth time, however many babies you've had, The optimum fetal positioning can come a little bit later, 36 weeks maybe. If you're having twins, then you need, obviously the due date is a lot sooner, so your optimum fetal positioning needs to kind of back up as well. And the only other thing I would say is people who have got very, very toned abs. And we do get them now and again. Some people do a lot of toning, maybe because of their job. There might be a personal trainer, there might be a dancer, there might be a gymnast. There are lots of reasons. Might be an athlete. Lots of reasons why people will have, might be a model, why people have like very, very tight, solid abdominal muscles. But what that means is the abs don't stretch so much during the pregnancy, and so the baby then gets pushed back in towards the organs, and it means that you need to start optimum fetally positioning a lot sooner because you're going to run out of space sooner. So the idea is you do the optimum fetal positioning moves before you run out of space, because once your baby runs out of space, they can't turn. So if your baby gets into a bum down position, let's say 33 weeks, and then you don't do anything about it, you don't do any kind of moves, they're going to stay there, because then the abdomen, they're going to run out of space. They're going to get bigger and bigger, they're going to get wedged in. And so that's why you need to sort of start looking at these movements at the appropriate time in your pregnancy. So, and you decide when that is. Is it a twin? Is it a second pregnancy? Have you got a six-pack? All of these things will play into when you decide to do your movements. Okay.
Julie, when's the baby too big to move? Is it like the same?
Really good question. And there are lots of factors on that. It depends, mostly depends on the mother's size. Shorter women tend to have less space. So when you have women who are like 5'2", 5'3", 5'1", you often see them having very big bumps because there's nowhere else for the baby to go. The baby has to come forwards. They will run out of space quite soon. And then when you've got tall ladies, there's a lot more space here. So they've got a lot more space. In fact, I had one mum years and years ago. She was very tall and very skinny. And her baby was transverse at 39 weeks. And they booked her in for a C-section. And we did some work together. We spent the whole session, everybody had to do it for her, and we spent the whole session doing these kind of turning baby moves. And she went in for a C-section, scanned her, and the baby was head down. And she was 39 weeks and as skinny as a rag, but she was tall. So I think she managed to, there was space there for her baby. So it will depend on things like that, on your size. So obviously, and also how, babies grow differently as well, don't they? And then you have to factor things in like diabetes. If you've got gestational diabetes, those babies tend to be a bit bigger, which is why they induce you early. And so you probably have to do your optimal fetal positioning a bit sooner because the baby's size is projected to be a little bit bigger. So there's no definitive answer to that. It's like 101, pieces all coming into play.
Can I just ask, how do you know, because a lot of people don't have a scan after the 20th scan, is it at your midwife checks after that, they'll tell you what position?
Midwives always palpate, so whenever you have your midwife check, they palpate. Having said that, and they listen for the heartbeat. Having said that, they do miss them sometimes, it's not as accurate. And I've known, we had somebody a few years ago who turned up with a breech, and because the midwife said, yes, fine, head down, and then she was delivering her baby, breech baby, and then of course all the midwives go, ugh. But it was fine. She birthed her baby because she comes to classes and she squatted and she did her stuff. And does that happen to somebody you know?
Yeah, that did that. And she had to be rushed in for emergency C-section because she was like, it's not right. And they were like, no, it's fine, you just need to push. And she was like, I can't push, something's not right. And then they seen that it was the shoulders.
Right.
And they were like, that's not coming out.
Yeah. So, so in terms of, If the midwife suspects that your baby might not be head down, then they'll have another scan. They'll book you in for a scan. They used to, again, it changes all the time, and I'm not really, because I don't work with the midwives anymore, I'm not really sure what the guidelines are now, but they did used to give you a scan at around 37, 38 weeks, but they don't do that anymore, I don't think.
20 weeks is your last one.
20 weeks, yeah, see, that's something that stopped. They always gave you a scan towards the end of your pregnancy. But I'm so,
each midwife one night, like they do
Yeah,
fill in their
yeah,
write it
yeah,
down.
yeah.
but as I said, it's not accurate.
Sometimes if it's head down, then you can feel like the hiccups down there as well, can't you? Then
Yeah, this is my second one, but I just can't remember ever being. I mean, I had a really nice first labour, luckily, so maybe that's why I was never told anything.
Yeah.
But this feels like all brand new information to me.
How many babies aren't in that optimal position? Do they know?
There might be some data somewhere about that, but I haven't got it. I don't think I've got it down here. I do sometimes have bits of data. I don't know. And I know from my perspective, because we do all this work, you know, I think women that do a lot of the yoga type stuff, because we are focusing on making space and doing all these lunging movements and being on all fours. These are the positions that help. And then, you know, I talk about sitting on chairs. So now you know that you're not going to slump on your chair. And so I think, yeah, I don't know. There might be some information somewhere. But then it won't, as I say, it won't necessarily be, so out of the entire population, say if like 40% are malpresentations, it's very likely that's going to be 40% of 100% of women who don't go to yoga or antenatal classes and slump in a chair all day. So, you know, who are sedentary, they don't even go for a walk. So it may be that's it. We might not necessarily learn anything from that data anyway. Okay, so it's all to do with the angle between the maternal spine and the pelvic brim. So this is what you're looking for when you are determining the amount of space that a baby has. So the lumbar spine, as you can see, mine doesn't do it, unfortunately, but you can change the angle between your pelvic brim and your lumbar spine by about, I think it says here how many degrees. I'm putting it down somewhere. No. But there's a big range in terms of how much space there is between your lumbar and your pelvic brim, between doing this position, and that you can tell, can you, when we sat on the chair in the two different ways, when you're sitting forwards, you're in the full optimum position and it feels very spacious, doesn't it? And then when you slump and the tailbone tucks under, you can feel there's no space. So there's a big range. I think it's something like 30 degrees in terms of how much difference in space you've got. And that's what you're looking for. So bucket chairs, comfy sofas. So sitting in cars, that's another one. Cars are designed for men to sit in these racer driver positions. You know, my car is awful. And so you might find, particularly during your pregnancy, that you need a cushion or a block underneath you, because if you find that when you're sitting in your car, your knees are higher than your hips, if you're like this when you're driving, and you're driving like half an hour every day to work or an hour every day to work, then in this position, that's very much the rounded position. This is very much what you don't want. So what you might need to do is adjust everything. So steering wheel down, car seat up, pump the seat up as much as you can, and even then you might need to put something underneath your bottom, like a cushion or a chair. You can actually buy car wedges, I think, these little cushiony wedges that go under your bum in a car. So check your car, make sure that it's all in the right place. Okay, so here is what we do. So our first optimum fetal position is all fours. We do it every week, and now you know there's another reason why we do it. As well as it being a fabulous position for labour, we do it as a preparation for labour, in the sense that we are allowing our baby to get into the right position. So coming onto all fours, and as we've done before, you can either come onto your ball and use your ball. If you've brought your ball with you, you can use your ball. As you've got your chairs handy, you can come onto your chairs actually. If that's more comfortable, just rest your elbows on your chair. And then we're going to circle the hips around. So one of the things that we recommend is that as you get towards your 34 weeks, you start to spend much more time on all fours. So if you sit in the evening on your sofa, come off your sofa now, get onto your ball and sit like this instead, or kneel like this instead, because this gives your baby a lot more space. And again, it's more comfortable, isn't it? Or you sit back to back on a chair. But we do recommend don't sit on your sofa anymore. So just noticing how that feels. And then just circling the hips around. So again, the same movements that we use in labour are also the same movements that we use prior to labour to get the baby in the right position. So the second thing that we want to do is to circle the hips. So we're going to circle the leg around to the front, and it's again these lunging positions that are really good for helping to change the baby's position. So lunging forwards and backwards to just stretch into your pelvis, and again you can either do this on the ball, you can do it on the chair, or you can do it with your hands on the floor, so whatever feels most comfortable. And then circle the hips around. So this is your big movement. This is the one that I use when I'm working with women who need to turn a breech baby. So you're circling your hips in this lunging position. So can you feel the space here? This is such a big space for your baby. And then you can slide that leg back. Now, downward facing dog, if your baby isn't in the right position, if their bum is down, then coming into downward facing dog is a good way of kind of gravitationally pulling your baby out of the pelvis. So letting gravity do the job. And then bringing the knees all the way back down. And then we're going to take the left leg around, bring the left leg to the side of the left hand, and then just easing forwards and backwards. And then circling the hips around as well. Relaxing, and then we'll go back on to the heels, so making space for your baby. Roll the spine to the ceiling, and then just blowing the breath out gently between the lips, using your straw breath. Gently bring the hips all the way back onto the heels. And then breathing in, rising all the way up, and then do the same thing again. Coming back. breathe out, straw breath. Nice, cooling, relaxing breath. Breathing in, come back up. And then same again. Okay, so also sitting, when you're sitting in the class after 34 weeks, if even in a normal position, so I've said this before, so kneeling is a really good position. And I used to have loads of blocks where we could all kind of sit up quite high, but thanks to COVID I got rid of them all. But what you might want to do is have a couple of blocks, if you've got some of the big bricks, and then you can put your cushion on top of that, so you're making a little bit of a tower, and you put your feet either side of it, and then you come and sit back, so you're kind of elevated, so the pelvis again is higher than your hips, so it's this angle, this maternal angle that you're looking at. So some of the things that are recommended after 34 weeks, spend at least 10 minutes every day on all fours, so just rocking on your ball, maybe doing some lunges as well. Walking and swimming frequently. So we'll look at the standing position in a minute and how that helps with the pelvis, but it's very similar to when we're doing the lunges.
I found swimming quite an odd feeling. So it just felt like everything was being pulled down. I don't know if it's because it was an old swimsuit and it doesn't really fit.
I quite liked the swimming when I was pregnant because it made me feel really weightless. Felt really light.
It gave me heartburn as well.
Yeah, because you're forward. Sitting and leaning over a birthing ball or a bean bag, thinking about your posture and the angle of your pelvis. Sit with the knees lower or level with the hips. Excuse me. So the other thing I wanted to mention is sofas. So sofas have their own particular issue, slightly different to the chair. So when you sit on a chair, it tends to be the legs not touching the floor. But on a sofa, it's because the seat is too deep. So most sofas have really long cushions, to make it supposedly nice and comfortable. But what that means is you can't get your feet on the floor. So if you imagine this is a sofa, it's going to come out probably to there. And then that means I can't get my feet on the floor. So we have to sit like this. How many of you notice that you sit like this in your sofa? It's just such a bad position to be in generally, but when you're pregnant, it's a definite no-no. And so what I normally suggest is after about 30 weeks, don't sit on your sofa because it'll give you heartburn, it'll give you backache, it won't help your baby get into the optimum fetal position. It'll help you breathing as well. We talked about this. It's all connected. You need that space to be able to breathe. So what I normally recommend is that as the pregnant one, you are allowed to lie full length on your sofa, and everybody else has to sit on the floor. So that's an option. Sort of, you lie full length, sort of goddess style, or you sit on your ball, or you sit backwards on a chair. I definitely recommend coming off your sofa. Don't try to maintain left lying at night in bed where you haven't got any control over this, and then sitting backwards over a chair, which we've looked at. And then things to avoid. So again, sitting on the sofa, sitting generally for long periods of time. You're better off sitting on your ball or leaning over your ball. Obviously if you're at work you can't lean over your ball, but if you're at home and you're watching TV or something, or just talking or reading a book, come over your ball, come onto the all fours position. Think about long car journeys as well, particularly if your car puts you into that horrible slumped up position. You might have to break your car journey down and then have a walk and then get back in. because every time you kind of get up and you move, you'll give your baby a bit more space. If they're trying to get head down, if you spend 7 hours in that slump position, they cannot get into that optimum fetal position. But if you give them plenty of opportunity, they'll be able to get head down. Avoid crossing the legs. Also deep unsupported squats, because again that kind of slightly tucks the pelvis under. Any position where your knees are higher than your hips, and this is, I knew I'd got it somewhere on here, this reduces 120 degrees to 90 degrees, so 30-degree angle. I did remember that properly. So it reduces the angle by 30 degrees. So I've got a few positions here, and then the last thing I want to say is that sometimes a malpresentation is unavoidable. And there are various reasons for that. So the first one can be the shape of the maternal pelvis. It might not accommodate the head down position. And I've seen this happen. I think I mentioned it last week, had a woman, she came with both her pregnancies and we did everything we humanly could, and she had 2 C-sections because her babies were breached both times. So we just have to assume that her pelvis is not going to support a head down baby, and so she had her 2 C-sections. 2 lovely daughters, not the end of the world. So. And also where the placenta is attached, so let me attach the placenta back to my baby. So if the placenta is attached anteriorly, which means to the front of your uterus, so the bit that's facing out, what babies tend to favour is fetaling in towards the placenta. So generally speaking, babies like to come into this position because it gives them more space. So the placenta takes up a bit of room in the uterus, and so if the baby faces in towards the placenta, it gives them some space as well. So not always, but a lot of the time they'll favour this position. So obviously where your placenta is fixed in your uterus is going to play a big part. So if your placenta is attached to the front of your uterus, your baby is going to favour this back-to-back position. So again, sometimes it's unavoidable. Again, I said if the core muscles are firm, and then some perfectly presented babies turn into OP during labour. But again, if you keep doing all those movements, those lunging movements during labour, it should help to make a difference. Okay, so we're going to come and stand up now. I'm just going to do a little bit of standing work that can also help with the positioning. So any kind of walking will help, because when you walk, you know, one hip drops, then the other, and obviously you've got all this space when you're not sitting. So it is recommended to go walking every day at 34 weeks plus or less if you need to have that longer period of time. Now just lift one hip and then the other. Just get a nice little sway going. And what you can see here is you can dropping one hip, and as you drop one hip, the that side of your body opens up into a bit more space. And so if your baby's not quite in a good position, then this dropping of one hip and then the other creates a bit more space. And then we can turn that into a circle. So you're going to circle the hips all the way around. We can also do the hip dropping with the arm lift. So you can do your heartburn at the same time, but even if you haven't got heartburn, this lengthens the amount of space in your body. So you lengthen the elbows up to the ceiling, then drop one hip, then drop the other hip. And can you feel the difference? You get a bigger stretch, and that means you've got more space. So you're making more space for your baby, and you take the arms up in this position. then these sort of wide movements as well. So you take the feet wide and you sweep over to one side, sweep over to the other side. And then again, if we take the arms up as well, we've got that extra stretch. So we can do a full circle, up and over, down to the ground. And then go the other way, so sweep the arms in the opposite direction. And then coming up. And then you can hold on to the back of your chair for this one if you feel that your balance might go a little bit off. But we can do these sort of knee lifting and lowering and knee circling. So circling the knee around and lifting. And do the same on the other side. So lifting the knee up. And then circling. And then shaking everything out. Okay. So that's pretty much it for that, unless you've got any other questions. Okay.